Spare a thought for psychiatric caregivers too. According to National Health Mission estimates, 67% of India's population suffers from mental disorders. That is, one in four families is likely to have at least one member with a behavioral or mental health disorder. The situation worsened during the COVID-19 pandemic as long periods of isolation, the fear of losing loved ones, financial difficulty, and the uncertainty about the future increased stress levels across social segments. Most of these cases remain untreated due to ignorance and social stigma. In the absence of visible proof of illness, deviations in behavior are generally attributed to attitudinal issues, marital troubles, financial problems, or job stress, while love affairs and examination stress are cited as the usual culprits. In the case of teenage behavioral issues, without proper diagnosis, the patient and their families keep suffering as mental health responses remain mired in myths, stigmas, and taboos. Causes for caregiver stress. Over 90% of psychiatric patients in India live with their families. The caregiver is under considerable stress because of the physical and emotional caregiving, along with the social isolation, financial difficulties, and troublesome behavior of the patient. A patient's non-adherence to treatment prevalent in such cases further exacerbate caregiver stress. In larger families, the primary caregiver burden is shared among family members, but with reducing family sizes, the role falls on the spouse. Chronic mental illness in a nuclear household disrupts daily life and drains family resources. Moreover, women caregivers face challenges in balancing caregiving, career, child rearing, and household chores, and are less likely to receive informal support for psychiatric treatment. Prolonged caregiving negatively impacts the psychological well-being of caregivers. Caregivers use various strategies to cope, which include sharing, spirituality, hobbies, and self-gas lightning. But unhealthy coping mechanism can negatively impact both caregivers and patients. Hence, the importance of caring for the family caregivers. Counseling services are currently provided to caregivers on request. This is not sufficient. As the situation of the caregiver is similar to that of the boiling frog, where the individual might not be aware of the emotional strain and hence will not request for support. Structured intervention is essential. The National Mental Health Program and the Decentralized District Mental Health Program remain focused on the patient but neglect the caregiver. Given the prolonged distress experienced by caregivers, it is essential to introduce a structured intervention program to educate and support the caregivers of the psychiatric patients. It should educate them about the illness and their roles and responsibilities, leading to a better sense of control over their own life and helping to cope with the caregiver role. Studies in developed countries show that providing support to family caregivers at the onset of the psychiatric illness of loved ones is crucial for the success of the intervention. Successful intervention models include cognitive behavioral therapies, psychoeducational skill building, family counseling, and peer support. In psychoeducational meetings with the families, the topics covered include a brief overview of the condition, current symptoms, early warning signals of relapse, available therapies, and their effectiveness, safety of treatment, typical side effects, treatment-related expenses, burden identification, and coping mechanism. Caregivers receive behavioral intervention, counseling, and helplines to manage anxiety and stress. A preliminary inquiry into the preparedness of healthcare system to provide caregiver support raises multiple concerns. A lack of trained specialists hinders cost-effective intervention model implementation. India has 43 state-run mental health institutions with 3,800 psychiatric and psychiatrists and 900 clinical psychologists. That is, one psychiatrist and a psychologist for every 4 lakh and 16 lakh citizens, respectively. Insufficient budget allocation for mental health patients also raises concerns of developing intervention for psychiatric caregivers. The gaps in insurances. The gaps in insurance. Though private mental health institutions provide some fillip, their services are expensive and beyond reach for many. Mental illness are excluded from the list of ailments covered by leading medical insurances in India. The Mental Health Care Act 2017 provided a corrective step with the mandate to treat mental disorder on a par with physical disorders for insurance coverage. Government schemes provided by public sector insurance companies such as the flagship Ayushman Bharat provide coverage for mental disorders. However, coverage by private insurers remain limited. Several non-governmental organizations and community movements such as Mindroot, Lone Pack, and the White Swan Foundation have been engaged in community support work for people with mental illness and their caregivers. However, given the severity of the issue, their scale remains insignificant. In the backdrop of reducing family size, increasing life expectancy, and poor institutional support, the caregiver burden in case of psychiatric illnesses is expected to keep worsening. The lack of tailored interventions may negatively affect caregiver well-being and patient treatment participation. A comprehensive treatment of severe psychiatric illness in the future would need building effective partnerships between healthcare professionals, informal caregivers, and psychosocial interventions where required.